Hello and welcome to our monthly webinar for September of 25. This is our monthly webinar for weight loss surgery in Mexico with Mexico Bariatric Center. We do this pretty much every Saturday, first Saturday of every month. And unless there is some kind of conflict, we always on the first Saturday of the month. I'm still waiting for everyone to join. Just to mention about a raffle. This is an opportunity to get almost half of the already affordable packages we have off, which is $2,000. You need to do you need to have a health questionnaire in our system. If you have submitted one and is not more than 6 months old, you don't need to resubmit it. Basically, if you are submitting a new application, health history, please just select Dr. Miguel Montalvo and be present throughout the Zoom presentation. We do release a Zoom poll at one time. Make sure you fill that out. And at the end, after the Q&A, we would do a raffle and we draw one name and we would announce that. So again, welcome everyone to our monthly webinar for weight loss surgery in Mexico. Actually, I do have Dr. Montalvo joining me from our office in the Hospital Azar in Tijuana, Mexico. Hello, Dr. Montalvo. How are you? Welcome. Thank you for taking time. And myself, I'm in my office in Sacramento. This is where our headquarters is located. Again, make sure if you do not have a HQ in our system, submit one, and we would be drawing a raffle for $2,000 off at the end of the webinar. Just a little bit about me. I've been in the medical tourism industry, specifically in Mexico, from 2007. I started Mexico Bariatric Center in 2012, and we've been one of the top providers of weight loss surgery in Mexico, and Mexico is becoming the epicenter of bariatric surgery in the world. And I started a hospital project, Hospital Azar, in 2021, and we finished it last year. We're almost at the 1-year anniversary right now, and we've been very successful with the hospital. We started just recently offering Botox and fillers to patients and companions, and constantly we're offering new procedures like SASI and MAGDI, which Dr. Montalvo is going to touch base on. We also are offering gynecology, like hysterectomy, endometriosis, and here's the beauty of it. You can actually get, let's say, gastric sleeve, a combination of gastric sleeve and hysterectomy together. And we started offering hip and knee replacement. Again, another exciting news we have is that we have a underground coordinator now in New Zealand, and they actually traveling in groups. Of course, individually they come too, and we have a special package for patients coming with Vanessa in the group. Yeah, so another exciting news is that we will be in Auckland in November 21st. It's coming really fast. Palmerston North and Christchurch. And we will have a seminar November 21st, 2nd, and 3rd. Myself, Vanessa, and Dr. Gutierrez will be there. Hope to see you. And again, our website is very informational, resourceful, and we constantly publishing new articles about the services we offering, or about diet, about meals, and different subjects like eating disorder after bariatric surgery. That was the one we published last month. And so you need to know about how resourceful this site is, so you can constantly check for new stuff. We try to cover the questions that are commonly asked in the presentation. Please make sure you pay attention. And if you didn't hear the subjects that you're interested in didn't get covered, please go ahead and ask us at the end. We try to limit this presentation under 2 hours, and we try to cover as many Q&A possible. But if we didn't get to it, please go ahead and circle back and ask us. We always here to answer you. Every patient gets assigned to a specific coordinator, and it's like your case manager, and that person will be in charge of your file, so you don't have to explain every time about your situation. So you're dealing with one person, so that you can always come back and ask questions from your coordinator or call our office. Just the subjects we are covering today is about, we all know obesity and its risks. We will touch base on how to calculate your goal weight, your ideal weight, and what to expect after weight loss surgery. What does weight loss surgery actually do, and how is it stack up against medications like Ozempic or other weight loss options? And we talk about our hospital, newly opened hospital, how to schedule, what our packages cover, and our support programs for our patients. Dr. Montalvo at that time would take over and would talk about all the options we have laparoscopically, endoscopically, reversal, revisional, all that we offer. And of course, this is about bariatrics. We do have a cosmetic department also, that they deal with skin removal, facelift, body contouring, and that's a beauty. I would touch base on that when I go over BMI, actually. And we talk about medical tourism insurance option we offer at an affordable price. And we talk about our nutritional programs. And then we will go to, like I said, questions and answers, Q&A, and try to cover as many as possible. And then we do the rough. We all know what obesity is. Basically, in the modern age, there are factors that is contributing that we all know. I'm going to cover it in a bit. But in the medical field, there is a formula that you plug in your height and weight, and you get a number. And that number puts you in this chart. Let's say if my BMI is less than 25, I'm normal. Anytime I start going over 25, I'm going to the overweight zone, and after 30 is considered medically obese. And then there is a degree to obesity. So they're all like called super morbidly obese and whatever. So one thing about our center that you see is we don't have limitation of what we can handle. the BMI, we've done a BMI over 110. So we don't turn you down because of BMI or is the complexity of the surgery. So if it's possible, if it's doable, we can do it. Now, one thing about plastics I wanted to mention here is one thing good about our services is we get a lot of patients that they come in and their BMI is about maybe 35, even sometimes 40. They're asking for lipo or mummy makeover. They think that that's going to help with their weight. We don't offer the services like that to plastics. We send them to the bariatric side. So you go lose weight and then you come back for getting skin removal. And that's the one thing, because we can offer all these different services, we're not going to give you something you don't need. We talked about goal weight or ideal weight. So let's say if a female at 5'4" with a medium frame size is weighing about 220 pounds. You see from the chart, the chart on the side, on the right side, it shows the height, the gender, and the frame size, and what is ideal, right? So because we all made differently, our frame size are differently, so that's why we have this chart. So at the 5'4" with a medium size female, ideal weight is about 120. So this individual has 100 pounds of extra weight. And that's when they talk about extra weight, that's what they mean. Now, in the literature, there are some percentage of how much you lose of your weight or how much you lose of your excess weight. Okay, so let's say average low ball, 70% of your excess weight is lost after sleep. And then so that means 70% of 100 pounds is 70 pounds. So you end up around 150. But then again, we see that first of all, that average is higher with patients of MBC, Mexico Bariatric Center, and there is no limit of how much weight you can lose. Depends on your before BMI, how you do your pre-op diet, your age, of course, if you're taking medications, how active you stay after the surgery. So these are all factors. And as you see, for example, as we age, it's harder to maintain weight. And this shows like ideal weight based on age, okay? So I mentioned about the factors that contribute or attribute to weight gain. So increased nutrient content of the food, fast food, sugary drinks, sugar in general, processed, ultra processed food, lack of physical activity, that's huge. Comfort and stress eating. We go home, we're late, we're stressed, we're tired. What do? We eat. And then what do we do after that? We go to sleep. This is the worst. Inadequate sleep because of stress. Sleep is a huge factor. And in general, we got used to the idea of having large meals. So as we gain weight, not only the number of fat cells or adipose tissues increase, the structural changes happen too. And the structural changes causing insensitivity to insulin, to leptin. By the way, leptin is a hormone that is like, okay, so you've heard of ghrelin. Ghrelin is a hormone that tells you you're hungry. That's like a go hormone. And leptin is the stop hormone that tells you you're full. So when we have these structural changes, our leptin, we become insensitive. We get insensitive to leptin, which tells us to stop eating. That's one of the problems, right? So, and then we don't respond to therapies, to vaccination, to protein, to exercise. Our muscles don't respond. So no matter how much you exercise and you take protein, you still don't answer because of all the adipose tissue changes, okay? So obesity comes with multiple risk factors. 40% of Americans are dealing with this, I would say, pandemic, and has issues with our heart problems, heart disease, stroke, diabetes type 2, lung disease, immune system problems, impaired immune system, inflammation, and during COVID, we realized that because the coronavirus attaches itself to the fat cells, and there are more fat cells, now there is more chance of us catching it, ending in the hospital, ending in the ICU, and dying from it. And that's what we found out after COVID, that we better have a healthy lifestyle and lose weight. So what are the cures? Okay, so diet and exercise is the first thing that everyone tries. Again, eating well is a must, and exercising, being active at whatever level, if it's even walking for 30 minutes a day or whatever, it's a must. But obesity is a multidisciplinary disease, and this diet and exercise is not a long-term proven solution for obesity. And then from the beginning of human civilization, we always wanted to find a magic pill that we take and we lose weight. Okay, so now the magic pill is coming. Actually, it came as a form of injection, which is Ozempic, and is a great invention, I think, but still is not a long-term proven solution. We will see. We would compare the two side by side, and you will see, because you have to keep taking the injections, okay? So that this time, bariatrics is a proven, quick, safe, and long-term solution to cure obesity. This is a good graph I like. When we go on diet, the body reacts. So the reaction of the body makes it harder to get to your weight goals. And the way is explained at this time is bariatric surgery resets our metabolic system. And that's exactly the magic, right? So if I weigh 250 pounds, because the way my brain and my gut hormones are interacting, my body is used to that weight of 250 pounds. And when I go on diet, and let's say if I do boot camp type of exercise, and I managed to lose 75 pounds, that's huge, right? Not everyone can do, but let's say I managed to do that. Because my body is used to that 250 pounds, my body thermostat or metabolic system wants to take me back to that 250. What does it do? It makes me more hungry, my hunger goes up, and my metabolism goes down. And that's a resistance that body is doing against that. Now, when you do bariatric surgery, because of the manipulation in our stomach and our intestine and our guts, it resets our metabolic system. The minute we wake up from the surgery, our metabolic system is reset. So after bariatric surgery, the brain sees you at 175 pounds. And as a result, your hunger goes down and your metabolism goes up. So that's the magic. Yes, the bariatric surgery magic is recalibrating your metabolic system. And we talked about the difference between the injections or well, we'll see. There are two categories of these medications, but you know it as Ozempic, Wegovy, Mounjaro, or Zepbound. What they try to do is they try to simulate the effects of the hormonal changes of bariatric and metabolic procedure. On the right side, you see these are the known hormones that are changed as a result of a bariatric surgery. And as you see, there's so many of these are changed. So what they did was they're trying to simulate this. So they created first GLP-1, which you all heard GLP-1 synthetically, which is a fake hormone, and he injected to simulate one of the effects of bariatric surgery. And then the Mounjaro came up with an additional hormone, which is GIP. And as you see, there's still two of the very many that is created naturally in the bariatric surgery. Now, also remember, for example, in gastric sleeve, as Dr. Montalvo is going to explain, you actually creating a physical restriction on the stomach. But these medications don't do that, right? So as you see, semaglutide and tirzepatide, these are two different categories that you see in the market right now, okay? And they're coming more and more because at the beginning they pushed this, to market it really big time, and it was like a solution to all. But now they're finding out, okay, so many 70% they stop after first year because of the stomach issues, because of you know cost, because of inconvenience. And then if you stop, you gain all the weight back and more. And there are some vision problems. It could be creating cancer. And as we see, I mean, again, these are great medications. They could be used in certain occasions, but is not an answer to obesity. Okay, maybe if you have taken surgery before, you can still use that to maintain your weight, or you can use it before weight loss surgery to reduce your weight, so it'd be easier for the surgery for your pre-op, but it's not a answer for all. As you see, diet and exercise only works with a small portion of the population. Then it becomes the Ozempic-like medications, and then endoscopic procedures, where Dr. Montalvo is going to explain about gastric balloon, endo sleeve, which is we call ESG. And then there's gold standard, which is sleeve bypass, duodenal switch, the newer ileal surgeries like SASI, SADI, MAGDI, which is the magnetic way to create the junction between the intestine, which Dr. Montalvo is going to explain. So if you're underinsured or uninsured, or your insurance doesn't cover obesity treatment, surgical treatment of obesity, medical tourism, especially Mexico, stands out as far as not only affordability anymore, also the quality of service. And when you're looking to go to Mexico, the best choice is to find a provider like Mexico Bariatric Center that covers all your needs from transportation, hospital, your doctor, of course, medication, and they are there for you. So you're not taking any risks, and it gives you peace of mind. You know that you're going to get picked up. You don't have to worry about hotel reservation, worry about anything. And like companies like us offer medical tourism insurance, of course, optional, but at a very affordable prices. Again, MBC, Mexico Bariatric Center, we are a US-based corporation, and our headquarters in Sacramento. Our mission from the inception has been providing top quality services, weight loss procedures for affordable prices. And in a way, we are a US company. If you look, there's not very many companies left like us. And we are pretty much the leader in the industry. And MBC is literally regulating the bariatric surgery industry in Mexico and worldwide, because we set the standard so everybody else has to come and pretty much comply with that standard. Whether it's Mexico or anywhere else, we have set the standards and they need to follow that. We have MBC has 13 years. Like I said, I started my career in this business in 2007, but MBC has 13 years of track record. We have done over 28,000 successful bariatric surgeries with the top 5 bariatric surgeons in Tijuana and Guadalajara. You see why MBC, but this is like a little pointer here to show you what about our surgeons. There's not enough to be said about our surgeons. The years of experience, the reviews we have, whether it's on Google, Facebook, we're not buying these reviews or fake. They are real. They're real patients. And the medical care at Hospital Azar, the treatment we take care of you down there. We manage the load of the surgeons by giving them enough surgeries a day based on the complexity and not overwhelm them or overload them. That's one of the reasons that our complications rates are so low. You see why. So many reasons. I have so when you first look for weight loss surgery in Mexico, there's so many companies pop up, and he's like, okay, which one do I go with? I would say, first of all, there are so many newer surgeons that come in to this industry, but they don't have the experience or the background that our surgeons have. And I always compare the experience of the surgeons, of an assistant surgeon or a lead surgeon, like a pilot. Do you want to give your life to a pilot that only has had 200 hours of flight time, or a pilot that has had 10,000 hours of flight time? Of course, a lot of times nothing happens, but that one time you need their experience and they would fail. So that's why you need to look into what's the experience. They all claim that, oh, we've had so many surgeries behind us. Yeah, maybe when they were at school, they were watching those surgeries done, but when I mentioned about 28,000 surgeries, we have a proof. It's in our database. We know these are real patients. And since then, because the other companies don't have the same amount of expertise or experience, they try to fake their numbers. But anyway, again, I also want to, especially for plastics, but for bariatrics too, for social media. Social media is a great tool, but you have to make sure these are not just some cute Instagram or TikTok or Facebook videos or short videos that try to make them look good, but really you need to do deep research into who they are, who is behind all this. You can always create a great website. There are these companies all go to, there is a huge company that does, especially for Mexico, advertising. They make websites and they make it look so great and Google friendly. They pop up, but they are paying dearly. But what's the infrastructure? Like who's running the program? Who's in charge? Do they support you if you need before or after? Or, we're always here. You can call us, you can ask questions even after your surgeries. What's their credentials? So you need to find that out. I'm going to have a little video of our hospital that we started last year in September. So, so, so when we talk about our hospital, by the way, the name of the hospital came um, from my mother that actually passed away right after we started the hospital last year. When we're talking about Hospital Azar, it's not just another hospital or a surgery center. This is a place that was made specifically for medical tourists, specifically for our company, specifically for our patients. Is a private company, private hospital. All the expertise are zoomed or focused or designed around bariatric plastics and laparoscopic endoscopic surgeries. So you're not dealing with a hospital that has emergency walk-in or this or that. You have to remember, these other hospitals, they take patients, they are different teams of surgeons coming in and going. As you see, these 5 bariatric surgeons are exclusive to MBC. This is all the traffic. And of course, we do have a team of plastic surgeons that they're also exclusive. So we don't have, so you basically in a private hospital, in a private setting with the patients like yourself. So this is the thing you have to remember, from not only the views of the rooms, the comfort of the rooms, the environment, the where it's located, the technology that is used to build ORs and sterilization and all that. So this is a really top center in the world right now for what it does. So something else that we started doing is we allowed companion actually stay in the hospital with the patients. So you do have option if you want for your companion to stay in Hyatt or stay with you in the hospital. That's up to you. Of course, some patients are comfortable to have their companion around, but for companion is more comfortable to be in the hotel. So that's a decision you make, but you do have that option now. Our process is very simple. We have 3 steps. You submit a health questionnaire. By the way, if you haven't done one, please submit one so you can be entered in the raffle. We run that through our surgeon liaison with our surgeons. You see the diagram in a moment. And then you get a notification, SMS and email that, hey, you got approved. Now, you got approved for that type of surgery. You go online, you can actually book yourself by finding the date that works for you and the surgeon is available. Pay the deposit is $195 only. These are all limited time offers. So please take advantage of it. So, and then you basically book your flight and submit your paperwork, and you're done. You are on your way to your journey to transform your life. We have a group in Facebook that we will mention in a minute. This group, I see these pictures that are so amazing. People really, you're taking control of your life. And this is such a great tool. This is really a result of the advancement in the medical technology to be able to do this stuff laparoscopically or endoscopically. And the prices that we offer is amazingly affordable. I mean, our gastric sleeve starts at $39.95. And I mean, with the package that you get, including the hotel, hospital, all the fees, when we're talking about our Facebook group, we do have several Facebook groups. The main one has over 13,000 of our past patients. Okay, and we do have one we called Inside Facebook group, MDC, which is the people who are starting to submit a health questionnaire. They don't know what's like. There's a bunch of people there that they can guide you of how it's like to be a patient of MDC, what it's like to be a bariatric, post-bariatric patient. And this is the type of support you need and you get from us. Of course, we do have frequently events like surgeon Q&A. That's the one I recommend every Wednesday, 10 to 10:30 Pacific time. You can jump on Facebook. There is a half hour that you can ask any question from the surgeons. We rotate the surgeons. And we do have coordinator lives. Basically, there is every Saturday of the month, I go live with our webinar like we doing today. And this is a support, another level of support you're getting. Look at, these are our past patients working with us every day to support you. Sarita, she's mostly active on Facebook and social media, helping patients to get questions answered. Rena, Jamie, Kelly came to us looking for plastics. We told her you need to get bariatric. She got bariatric first and plastic second. And she looks great. Laura Tiffany is in our MCC group, Mexico Cosmetic Group. Vanessa mentioned she is our underground coordinator affiliate in New Zealand, close to Auckland. And Anna is our coordinator in Canada. Rena and Sarita do occasional podcasts. You may want to look for those. People who joined later than I was explaining about the raffle of $2,000 off, you need to have a HQ in our system, and going to MBC, you can MexicoBariatricCenter.com, you can submit one, and you fill out the Zoom pool that I would release shortly and be present to the end of the webinar. Another success story of our company is our exclusive network of top bariatric surgeons in Mexico. As I mentioned, in Tijuana, most of them are in Tijuana. Dr. Usuna is the one that travels between Tijuana and Guadalajara. Dr. Miguel Montalvo, who is present today, Alejandro Gutierrez, Rodriguez Lopez, Jackie Usuna, and Dr. Jesus Sea. I mentioned about the way we handle the health history or the health questionnaire that you submit. First of all, over years, we have developed complex routines and algorithms that first, when you submit your health questionnaire, it will look to see what's the best option for you. And between that and the surgeon liaison, you get connected with the right surgeon. For most people, all our surgeons are available, but there are certain cases that they cover that the other ones don't. So we have you in the best interest to find what's the best option for you. You can still ask what's the best surgery for you, and they recommend it. Let's say if you're looking for sleeve and the surgeon said, hey, I think better for you to get bypass, they will recommend that. And this system ensures that every HQ is handled properly. We do use Hyatt Place, which is one of the top, most in demand actually, hotel, in Tijuana. As far as the pre-op diet, it's very straightforward based on your BMI. You get to do anything from 2-day clear liquid to a few weeks of pre-op diet. I cannot emphasize enough on how well you need to do your pre-op diet. The better you do pre-op diet, the easier the surgery on you, on the surgeon, and the better post-op recovery, better post-op results. And it shows your commitment to this life-changing procedure. As far as medications, please stop any blood thinner NSAIDs 1 week before. Ozempic type of medication at least 3 weeks before. Stop smoking, please, before and after. It really helps your recovery. And basically comply with the instructions that are given to you. These are all will be given to you, of course, specifically. And if you're taking any medication on a regular basis, bring the bottles with you. Even if it's empty, just bring it with you to Tijuana or Guadalajara. So you will fly into San Diego. Of course, if you go to Guadalajara, you'd fly there, and we pick you up from San Diego International Airport. There are 2 terminals there. Terminal 1 is under construction. Hopefully will be online soon. I saw last time I was there that they're almost done with the project. That would be really a step up for Terminal 1. Terminal 2 is already nice, and all the airlines like Delta, United, or American, they all go there. Terminal 1 is for Southwest. And we want you to arrive before noon, so that gives us enough time to get you situated, take you to the hospital, get the pre-op labs and all that. And we want you to have departure after 2 p.m. This way gives us enough time to get you to your flight back. If you're driving, that would be a different scenario. Of course, you just park in the parking San Diego International Airport. You take the shuttle, you go to the airport, they get pick up. Now, here's the thing. The day before your departure, the transportation people are going to contact you and tell you what to do, what to expect. When you come out of the airport, it's very simple. You know, all the sidewalk is signed with different alphabet from, let's say, F and D. So you tell the driver, once you come out, that's where I am, and they come get you. This will all be communicated with you. And also want to make sure you don't pack heavy. You really need a one suitcase and not even a big one. The weather in San Diego and Tijuana, which is similar to San Diego, doesn't fluctuate so much, you know. It doesn't have extreme hot or extreme cold. Yeah, it gets chilly, but not like snow or anything like that. So you really don't need to bring a lot of stuff with you. On the day of the surgery, if you're in the hospital, no problem. They tell you what to come get you. If you're in a hotel, they tell you what time to show up in the lobby, and they pick you up, they take you to the hospital. Hyatt, if you stay in Hyatt, if you stay in Pueblo Amigo, is a little bit out more distance. But between Hyatt and Hospital Azar is about maybe 3 short blocks. You know, it's very easy to walk back and forth, but of course we have transportation back and forth. But they take you there, it takes a few minutes. You stay there, depending on the procedure, whether it's endoscopic, laparoscopic, 1, 2, 3 nights. We do all the post-op tests, multiple leak tests, and you're ready to go back. You always have option, by the way, to stay extra in the hotel, extra in the hospital, extra in San Diego area, because we do have special rates if you mention our name with Hampton Inn by the airport. We used to have that option with Sheraton, but Sheraton is so in demand right now, and the rates are so high, they don't give us that special rates anymore. Post-op diet, again, these are all important for your long-term success. Okay, so it comes in four weeks in 4 phases. Okay, from clear liquid to solid. You have to transition that. And again, this is a life-changing transformation, and you need to work with it and work on it. So we're talking about expected weight loss, excess weight loss percent. Remember when I was looking at the ideal weight, body weight? This is statistics from our past patient. We don't have the 2 years. You still lose weight until 2 years, okay? Even at 1.5, which is 18 months, you see our sleeve average is over 74. That's more than published average. Our RNY 80, mini bypass 81, and duodenal switch 86. These are all more than what is published and what other companies can do, whether it's in the US or Mexico or anywhere else. So the technique we use, the experience of the surgeons, the skill of the surgeons is contributing to these numbers. And we're finding out that less than 5% of our patients coming for revision surgery. We do a lot of revisional surgeries, but they're not our patients, or they're not from, most of them actually, they're coming from US. And the published in the US is 15%, okay? And the reason they come back, only 74% is coming back because of insufficient weight loss. So if you work with the tool that you acquire with us, you'll be successful. Okay, it's a matter of working with it, being active, having the right diet. Okay, so now Dr. Miguel Montalvo. He's one of the top doctors in Mexico, I would say worldwide. I mean, these surgeons are so skilled, so experienced. Their background, their experience is out off the chart. And I can't say enough about his expertise. And I'm going to let him explain about himself a little bit, and if he wants to and go over the procedures we have. Dr. Montalvo, thank you.
Hi, hello to everyone. Good morning and welcome to this webinar. Let's talk about all the options that our patients can have, since the worldwide more surgery is the gastric sleeve. We also have the mini gastric sleeve, the single incision, the bypass. In the bypass, we have the RNY or the OAGB, also called the mini gastric bypass, and duodenal switch. A lot of various laparoscopic gastric revision surgeries, and also we have endoscopic therapy like the gastric balloon, the endoscopic sleeve gastrectomy or ESG, and the endoscopic bypass revision, also known as TORE. Well, talking about the gastric sleeve surgery, in this kind of procedure, we remove approximately like the 80-85% of the stomach, using since 1 to 5 tiny incisions. And the size of the boogie, to calibrate the size of the stomach, is going to be 34 or 36 French, is used to shape the new stomach. Uh, in this kind of procedure, we utilize restriction to limit food intake, change the gut hormones that cause the hunger and satiety, and slow the gastric emptying. What to expect with this kind of procedure is to decrease the level of ghrelin. The ghrelin is the hormone of also called the hunger hormone. You're not going to have it anymore. Other expectation is to increase the level of GLP-1 and increase levels of PYY, and no changes in the G1P. So the pros can be easily revised if needed. Some patients who can get stuck on the weight, or want to continue losing more weight, or want a revision surgery, with this kind of surgery of the gastric sleeve, can easily revise if needed in the future. So high amount of excess of weight loss comparable to gastric bypass, the resolution of comorbidities like diabetes, hypertension, cholesterol, arthritis, no changes to anatomy, and less malabsorption. Why? Because in this kind of procedure, we are only going to remove a part of the stomach, but the rest of the gastrointestinal tract is going to be intact, and it's a short recovery time. It will depend on what kind of activity you do. The cons is patients with pre-existing acid reflux or GERD is not recommendable. So other kind is not a reversible procedure. In this kind of surgery, the duration is only 1 hour. You will stay 2 nights at the hospital, and the recovery will take from 1 to 3 weeks. Okay, the single incision surgery is the same of the gastric sleeve. Only here is that is performed only with one little incision on the belly button. So this kind of operation is performed through one opening roughly 1.5 inches wide the umbilical or navel area. So it's hiding inside the belly button, so the abdomen looks scar-free. The expectations is the same, decreased levels of ghrelin, increased levels of GLP-1 and PYY, and no changes in the gastrointestinal tract. So the process can be easily revised if needed, high excess of weight loss versus gastric bypass, and resolution of comorbidities, no changes of anatomy, less malabsorption, short recovery, and here's the important here is the aesthetic approach and the fast recovery. So what are the cons are can again is the acid reflux or pre-existing GERD. It's not reversible, and the most recommendable in these patients is to the BMI being less of 40. The duration is approximately 1.5 hours, and you will stay 2 nights, and the recovery is going to be the same from 1 to 3 weeks. Okay, talking about the endoscopic gastric sleeve. Here is a smaller stomach is formed by folding the stomach to create a banana-shaped tube. This procedure utilizes restriction to limit how much the patient can eat at a time. So in this kind of procedure, we're going to put a video device through your mouth, and that video go through your stomach, and that's how we're going to put some stitches inside. So it's scarless, and the duration is only 30 minutes, 1 night of hospital, and the recovery 1 to 3 weeks. So this procedure, the process is reversible, is reduced complication rates, no incisions, and short recovery. The cons is potential risk of partial openings of the small pouch and potential risk of ulcers. So the average at 1 year of excess weight of loss is 40%. So here the most important is the BMI to be a candidate for this kind of procedure. Talking about the bypass, the bypass, the most common or most known is the RNY, but we also have the OHB or the mini bypass. The gastric bypass, talking about specifically of the RNY, is a form a new stomach pouch while the remaining stomach stay in place. The small intestine are rerouted to bypass food digestion, which create malabsorption and reduce the calorie intake. So here the expectations is only slight decrease in ghrelin, increased level of GLP-1, increased levels of PYY, and the GLP is decreased, especially in diabetic patients. So this is why it's called a metabolic surgery too. So the process is one of the gold standard in high amount of excess of weight loss and improves obesity-related comorbidities like diabetes, high blood pressure, and sleep apnea. The cons here is that change of vomit and dumping syndrome and higher risk of ulcers. So as you see here in this picture, we need to make a small gastric pouch and make some connections with the small intestine. So that's why it's called a bypass. So here the duration approximately is like 2 hours. You will stay at the hospital 3 nights, and the recovery will take from 2 to 4 weeks. So this is combination of restrictive and malabsorptive procedure. You're going to eat less, but you're going to absorb less the nutrients. So which kind of procedure is the best for the patient? It will depend of the medical conditions, of the medical issues, or what kind of comorbidities, the BMI. It will depend on a lot of factors. So if you have a pre-existing acid reflux or GERD, severe GERD, the most recommendable is to make a gastric bypass. But if you don't have a previous surgeries or bariatric surgeries, your BMI is not too high, you don't have some comorbidities, it's going to be your first surgery. Well, the most recommendable maybe in these cases is to start with a gastric sleeve. The weight loss on both of them is going to be the same, all right? But that's not too much changes. Talking about the next kind of surgery is the mini gastric bypass. The weight loss on both of them is the same. Why? Because the connection is going to be the same for the weight loss. The mini gastric bypass or one anastomosis gastric bypass or OAGB is a mini gastric bypass divides the upper portion of the stomach to a tube, like a pouch which holds only 4 to 6 ounces of food. So the intestine is looped, as you see in this picture, is to connect the new stomach to decrease the amount of calories that you absorb. So like in the other kind of bypass, you're not going to absorb any more lot of nutrients. So it's very important to take your proteins, your vitamins, make your appointment to blood test and all that. The expectation here is to reduce the feeling of hunger through the altered gut. So that kind is a early satiety or feeling of full after small portions. They reduce the calories and nutrients absorbed and reduce diabetes type 2 and more. The process of is a single anastomosis to the connect the intestine is safe and effective and shorter procedure than the standard RNY bypass. Is one of the most effective surgeries to reverse failed sleep and lap band. So the cons is the change of vomit and dumping syndrome, high risk of ulcers, and change of bile reflux. So in this kind of procedure, the duration will take 2 hours, approximately 3 nights, and the recovery will take from 2 to 4 weeks. Sorry, 2 to 4 weeks. The recovery. It will depend on what kind of activity you do. Okay, so what's the difference between the gastric bypass or mini bypass? The weight loss is going to be the same, all right? The BMI is no problem. So here, I think that the most important is that if you suffer from a severe reflux or GERD. So if you suffer from this kind of issue, the best option will be the RNY to prevent that the bile liquid go through that loop and touch the stomach. In the other kind of the RNY, the liquid bile doesn't go through that connection, so go directly to the distant ileum, and no problem or it will resolution the reflux or acid reflux. Okay, talking about the next kind of procedure. Is another bypass, but it's called the Duodenal Switch surgery. So if you see in this kind of picture, is a combination of a gastric sleeve and a bypass. We're going to remove a part of your stomach, and we need to make some connections with the small intestine. So the duodenal switch surgery, also known as a biliopancreatic diversion with duodenal switch, is a powerful weight loss and metabolic surgery. So the expectations here is the patient to lose from 60 to 80% of the excess weight in the first year. The other is high percent of duodenal switch patients with type 2 diabetes are cured after surgery, and the malnutrition is a problem here with the patients with DS and vitamins is much after the surgery. So the pros here is up of the 80% of the excess weight loss in the first year, the stomach size reduced, highest metabolic effect, and highest effect of weight loss. But the cons here is extremely strict vitamins required for life and a higher risk than other bariatric procedures. Why? Because I already told you that it will take more connections, more surgery, more stitches, obviously more mobilization of insides. It will take a little more of little risk. And the durations here will take from 3 to 4 hours. You will stay at the hospital 3 nights, and the recovery will take from 3 to 6 weeks. Okay, well, the single anastomosis stomach ileal wheels with sleep. Uh, Here is like another combination of the also the a gastric sleeve and a bypass or a mini bypass. So the SASI is a new procedure that combines the gastric sleeve and the mini bypass benefits while reducing nutritional risk. So it preserves the natural digestions, lowering deficiency risk, and beyond restrictions, SASI harness hormonal shifts, GLP-1 and GIP, and the gut microbiome change from metabolic benefits. So here the patients lose from 65 to 75% of excess of the weight in the first year. Is a high percent of duodenal switch. Patients with type 2 diabetes are cured after their surgery and less complex than asatis. So the pros is the up of 75% of the excess weight loss in the first year, less cutting and stapling, and less risk of leaks, acid reflux, nutrients deficiencies, and can be reversed to a gastric sleeve, mini bypass, RNY, and SATIs. So here the cons is relatively new procedure, lifelong bariatric vitamins, and mineral supplementations. So the duration will take from 3 to 4 hours. You will stay at the hospital 3 nights, and the recovery will depend from 3 to 6 weeks. All right. Here, the difference between the duodenal switch and the single loop duodenal switch or SATIs, the BMI can be the same. And with the duodenal switch, the body absorbs fiber nutrients or calories, and the single loop duodenal switch, one fiber anastomosis or mesenteric window. So the dumping syndrome is one of the hits poorly, and with the single loop, never procedure will less that. With the duodenal switch, help relieve the sleep apnea, and with the single loop, resolves irritable bowel syndromes, and the excess of weight loss in both of them will, at 2 years, will be approximately like the 80%. Okay, talking about the SASI and the SATIs, the SASI can be for patients over 40 of BMI, and SATIs is more for patients with higher BMIs for 50. So in the SASIs, connect the sleeve stomach to the ileum. If you see, it's like a sleeve with a bypass, with a mini bypass. And with on the SATIs, here is more connections. Is to make a gastric sleeve, more connections with the small bowel. So it's a little more complex procedure. So in both of them, the average excess of weight loss in 2 years will be approximately like the 80%. So it's not a big difference, but both of them are great. Okay, talking about the revision surgery, we have a lot of patients who come for a revision surgery. A revision surgery is a repairing, revision, or moving to another bariatric surgery. So it can be from a lap band to a gastric sleeve, or an RNY, mini bypass, or SASI. A gastric sleeve can be revised to a sleeve or another bypass, duodenal switch, SASI. A gastric bypass or duodenal switch are more limits. So a gastric bypass or a duodenal switch can only be revised to a re-bypass, a TOR-A, that is an endoscopic procedure, or a duodenal switch. And the duodenal switch only to another duodenal switch or RNY. So we also have the revision for a gastric balloon, ESG, or BGB, or reversals. So the expectation in this kind of procedures is to lose weight that was regained after a previous surgery. The switch to surgery that is more effective and better for patients and resolve issues from the previous surgery, like the patients who can start with a reflux. We can make a revision to an RNY or a bypass, or patient who have a previous sleeve or bypass can be revised for to do another kind of bypass or a SADIs or SASI. So the process here is to continue losing weight again, relieve complications from a previous surgery like GERD, and weight loss may be more effective. The cons is risk of complications. Obviously, more surgeries, the risk is a little higher. So longer recovery time. Remember, because it's a revision, it's not like the first surgery. So here the duration of the procedure will take from 1.5 to 4 hours. You will stay at the hospital from 2 to 3 nights, and the recovery will depend from 1 to 4 weeks. The hiatal hernia. A lot of our patients had a hiatal hernia, and it's very important to get fixed this during the procedure. So hiatal hernia occurs when the part of the stomach pushes through the diaphragm, often causing an acid reflux or GERD. We typically fix the hernia at the same time as performing the surgery, and this will help to prevent complications in the future like reflux, vomit, or even strangulation of the stomach. Here, the prevalence is 4.2 times more than normal in patients with obese. The expectation is 1 in 3 bariatric patients have hiatal hernia. So if you see, it's like they're 30% of the patients. So small hernias is repaired during the gastric sleeve. Large hernias or GERD history has gastric bypass is preferred. Repairs are done laparoscopically through a small incisions, and unrepaired hernia can cause serious issues after the procedure. So that is why that is very important to fix this during this kind of operation. So here are pictures of, if you can see, the normal stomach down of the diaphragm and the hiatal hernia. The upper portion of the stomach go through the diaphragm, and that's the cause of the reflux or strangulations or sometimes pain of the stomach. Okay, talking about the MACD surgery, the MACD is called the magnetic duodenal ileostomy. These are relatively new procedures that combines laparoscopy and endoscopy. So a sleeve is created and the duodenum is connected to the distal ileum using minimally invasive magnetic technique. Over several weeks, the magnetics fuse to the intestine and are natural expelled during healing. So here, the expectations are fast recovery compared to traditional surgeries, lower risk of complication, and encourage uniform healing and durable connections. So the process is minimally invasive using magnets instead of staples or sutures, and can be used as a revision option for gastric sleeve and reduce or eliminate diabetes medication from 12 months after. The cons is risk of nutritional deficiency and a few clinical results. Their duration here is from 1 to 3 hours. Hospital nights will stay from 2 to 3 nights, and the recovery would take from 1 for 4 weeks. Okay, so here you can see the bariatric options comparison chart. Okay, so we also have the gastric sleeve. We also talk about the gastric bypass, the duodenal switch, the loop, or the ideal bypass, or also called SASI. And the most newest is the magnetic procedure, the magnetic procedures. So here with the sleeve is a surgical procedure that removes a portion of the stomach. The MACD can be added to boost weight loss by creating malabsorption. So in these cases of the gastric sleeve, with the MACD, it will make a conversion to a bypass. And that you're going to have the malabsorption portion. So, and on a bypass, the procedure creates a small stomach pouch and reroutes the upper part of the stomach with the magnet is less invasive and more effective. With the mini gastric bypass, also is a malabsorptive procedure, and the magnet is more effective and less risk of complications, obviously less sutures. Here with the duodenal switch or the SASI with the MACD, is the same hormonal benefits with less nutritional deficiency and less invasiveness. With the ileal bypass, the MACD makes the side-by-side connection with a less complex techniques. And the MACD procedure, we also talk about it. Here is using the compression. That's how they're going to make the connection. So other most common issues or problems is patients who had PCOS or the polycystic ovary syndrome. Here, the bariatric surgery show to improve and reverse the metabolic syndrome in women with PCOS. So here, reduce the symptoms and help restore the normal ovulation, have to have more normal hormones levels, and numerous of weight loss surgery patients of our Mexico Bariatric Center with PCOS have been cured and overcome infertility. Okay, one of the most common questions is how the patient can return to work after the bariatric surgery. So that will depend on what kind of activity you do. All right. If you're in an office sitting or with a sleeve, it will take from 1 to 2 weeks. If you have a bypass, from 1 to 3 weeks, and the balloon from 1 to 2 weeks. You stand or walk, it will take with a sleeve 2 weeks, or with a duodenal switch or a bypass 3-4 weeks. If you, the most time will be for patients who make lifting. From a sleeve will take from 4 to 8 weeks, or a bypass from 4 to 8 weeks. It's the most longer in this kind of patients. Okay, we also have cosmetic and plastic surgeries. So here also we offer this kind of procedure like the facelift, rhinoplasty, the tummy tuck, mommy makeovers, breast augmentation, breast lift reduction, the BBL or Brazilian butt lift, the liposuction, arm lift, hysterectomy, and the endometriosis, and the aesthetic procedure like the Botox and fillers. Also, the gynecology options like the hysterectomy or endometriosis. Laparoscopic hysterectomy is also minimally invasive procedure to remove the uterus with less pain, smaller scars, and faster recovery than the open surgery. We offer the partial and total and radical hysterectomy. and the endometriosis surgery. The endometriosis is a hard to diagnose. It's a distressful condition where the uterine like tissue grows also outside the uterus and can be treated with minimally invasive surgery. Also, the orthopedic options from the knee arthroplasty and the hip arthroplasty replace all the hip replacements.
Thank you so much for usually we have Kelly jump on the um, webinar and have a testimonial, but she's the one I was mentioning about. She came to us looking for cosmetic surgery, and we said your BMI is too low, too high, and she ended up getting a gastric sleeve, and she just went down there, did a plastics, and she looks great. She's one of our affiliates, by the way. We always have her come on, but this time she actually took her sister um, just a few weeks ago and had plastic surgery with us. Okay, so these are, let me see about, so I did publish the Zoom pool about financing. Just a few words about financing is please make sure you don't apply for too many companies at one time. If you need to get loans, if you have credit union or a bank you have good relationship with, that's a place to go first. And you could be creative with borrowing from your 401k plan or um, get a bank loan, things like that. So also we take a lot of different options, including cash, Zelle, credit card, some of the FSA, HSA work. Um, you may want to look at also companies. We do have several that is on our website, but companies like SoFi and Best Egg. On our website, you find Super Money, eFinancing, and Medicard. I mentioned about optional medical tourism insurance, which is MTI. We call it MTI. With the MTI, you get this kind of coverage for only $99. So I highly recommend everyone takes advantage of that. Our nutritional program right now, Natalie in-house in our Sacramento office, she's supporting patients day to day for pre-op, post-op. She has webinars. I recommend you jump on the webinars. She has it, I think, twice a month. As far as, there are all sort of information that we provide to you. One thing I need to mention is about multivitamins that are specific for bariatric patients made with the ASMBS standards with the best quality vitamins. This is Emerge Bariatric Vitamins comes in different forms from soft to chewable capsule. We do have protein also and drinkable. Um, I had a question in the patient asked, do I need to be on vitamin the rest of my life? Well, I would say with the duodenal switch, yes. For bypass, probably mini bypass. With the sleeve, at least the first 2 years, you need to take supplement and multivitamin. But the multivitamin you buy from the over the counter does not have the requirement that your body needs after bariatric surgery. So these vitamins are made based on what your body needs after. So that's very important to pay attention to that. Okay, so I think we are at the point that we can start answering questions. I would answer any travel logistic questions, and Dr. Montalvo would be answering things that are medical. By the way, I switched to headgear because there was some patient mentioned that my voice wasn't loud enough. I hope that problem has gone away. So Alma is asking Dr. Montalvo that do you recommend surgery after a gastric bypass? I had a surgery in 2013.
Okay. Yes, obviously. It had been since 2013. Is like 12 years ago. Yes, you're a candidate for a revision. You have the two options, the laparoscopic surgery or even the TOR-A. So yes, or even a SATI or SAS. You have a lot of options. Send your HQ so we can validate.
Yeah, as you see, we are starting, well, there is first of all, the field is, um, progressing as a whole, and they're coming up with all sort of different options. And our staff or our surgical teams are on the leading edge of all the procedures that are offered, including SASI, including MACD, all those different procedures that come up. We are in the leading edge of those. And like, for example, MACD is a really good option for sleeve uh, revision or conversion because it's just done laparoscopically and endoscopically together. But anyway, that's the advantage of coming to us because we have all different options for you. Will my sleeve fail if I start to eat too much again? I'm not planning on overeating, just wanted to know.
Yes, obviously. Uh, the procedure of the bariatric surgery is only a tool, but you need to follow up the nutrition plan and any kind of activity or exercise. But obviously, if you don't take or you don't take care of you don't take care of your surgery, you start again to eat what you don't need, more calories that you need. You don't make any, you don't move, you don't do any exercise. Obviously, you're going to gain weight with any kind of bariatric procedure.
What is the most common complication associated with gastric sleeve post-op?
Well, in less of 1% is can be the bleeding or can be the a leak. It's very, very low.
There was another question down there. They were asking, what do I need to do after I come back from Mexico? Basically, of course, you need to comply with the post-op diet, which we mentioned there are 4 weeks of going from liquid to solid, not lifting heavy weight, especially when you're going back with plane, even I mentioned about packing light and putting your suitcase in the upper compartment in the plane. All those things you need to be watching for. But also, so you only really need to check your blood test for vitamin levels and things like that. After the first 3 months, and then just have regular um, checkups with your primary care physician. That's all you have to do. Cynthia is asking, I can't walk very well. I have a foot problem, but swimming 30 minutes a day, does it have a similar effect?
Yes, this is very good. Swimming is one of the most best exercise because it will help you move everything with that. And the most important, swimming will help you if you have back problems.
Rhonda is asking specifically, how does bariatric surgery change the hormones and gut-brain axis?
Okay, Ron already talked about that. Everything is connect. All the hormones and the brain is connect. So when you make a change with your stomach or with your gut hormones, all this all the hormones travel through your blood vessels, okay, and make a response, send a message, and the brain send a response to your body. So obviously, talking about specifically the stomach, when you remove the part of the stomach, you take that hormone or the ghrelin or hunger hormone is not going to be anymore there. When you make some changes with your small gut, obviously the hormone is not going to travel or not going to communicate as the same as used normally. So that's how they work this kind of response.
Jesus is saying, I want to lose weight, but when I lose them, I regain them. And he bounces back. Well, it's funny because when we go to our seminars, the first question I ask is, how many people have been on diet and exercise and fail? And they almost the whole room raises their hand.
Yes, we already talked in the first part of the webinar.
Yeah.
So
It's like a yo-yo diet, yeah. You're not alone. So
that's why we are here.
correct. Okay, that's something about they're talking about Affirm, which is financing option. I think we have looked into that, but you can circle back and ask us again. I get my administration department involved in that. So, do we help patients fill out the FMLA? Yes, and that's something you can get from us, including in your package. Now, the age limit. Dr. Montalvo, you want to talk about what is the upper age limit? This patient is 70 years old.
Yes, talking about the guides or strictly talking about the age, is between 18 and 65 years old. But we already have patients over 65 that are in great medical conditions. So fill your HQ and put all the information so we can see if you need something, some special evaluation or validation. Sometimes it's a cardiology or a kidney specialist, or it will depend. But you can fill your HQ and we can see if you are a good candidate for a bariatric procedure.
My gallbladder and appendix was removed in 2001. Will this interfere with my weight loss surgery?
No, that doesn't interfere with nothing.
Yeah, Dr. Montalvo went over what's your recovery like. Again, don't lift heavy weight, just give your body enough time, give your body enough time to start swimming, give your body enough time to do heavy lifting. If you're a heavy lifter in the gym and stuff, just wait, but you'll be fine. I mean, we see so many of our patients that are becoming bodybuilders after. I mean, so many of them. And it's amazing to see the transformation. And I think in the slideshow, maybe they have some that I'm showing now, but we see that often that, yes. Now, this experience is, we hear some patients say, well, we do have anxiety to go down there, or we're anxious about it, or we're stressed out. Well, it's okay to be anxious, but not too anxious. If you put the positive energy, this actually would be a very enjoyable experience, because you go to Mexico. These people are very friendly. They're very warm, they're family oriented, and they take care of you. And you feel like so warm when you're down there. The whole staff are so caring. So just it's a really a great experience. Just try to enjoy it, and don't be too worried. Just take time and enjoy every step of it. And this is, as you see, look at this before after pictures I'm just showing right now. Honestly, we see this every day of how they have changed their lives, and they look so great. I mean, you adding years to your life, quality of your life, everything is just changed. So what happened was I released a Zoom poll. For some reason, it turned out the revision one, but I turned that off, and I resubmitted the one that was supposed to. So sorry for that confusion, but just do the one that I released after. The size of the magnet using in MACD, I think is, Dr. Montalvo, do you know, is like 2 inches. I think the new release, they might have done it 3 inch, but I'm not sure about.
Yes, approximately.
Yeah, it's about 2 to 3 inches, depends on which version they use. Okay, so that's another good question. How long after gastric sleeve is safe to do mummy makeover? We recommend 1.5 years. That's a good timing, because you have pretty much reached out to your goal weight, and you have recovered from the first surgery. You can do the mummy makeover after 1.5 years. That's our recommendation. Yes, if you stay in the hotel, your companion gets a free breakfast, but not in the hospital. Yeah. We highly recommend you bring passports, especially after, the new administration and everything else. It will be so much easier. And remember, sometimes you're coming out with a bunch of other patients that they have flights, and we don't want to have any delays for you or for people in the van with you. So it's really best option to bring your passport. It's a passport book or a card, either way it works. Okay, let's see. We're getting almost to be 1 hour 45 minutes. Okay, that's another good one. Can you get pregnant after gastric bypass? Is it safe?
Yes, yes. Or after any kind of bariatric procedure, you can have a get pregnant with any kinds. No, there's no problem.
Um,
A lot of patients get pregnant or who
Yes.
are
Just
searching to have a baby.
yeah, just wait for body to recover though. And so is gastric bypass reversible?
We need to check to check how the surgeon performed your gastric bypass, if there is the remnant pouch. We need to check everything inside to see if there's a chance of to make it reversible.
Yeah, so okay. So okay, so long-term effect. That's why I mentioned about the vitamin, right? The better job you do on the pre-op, post-op, recovery, taking vitamins, proper nutrition, being active, these are all factors that help you out in 10 years, 15 years, 20 years down the road, okay? The proper multivitamin, the all the other nutrition supplements that you need helps you with your nerves, with your bone density, all that, yeah? So you lose weight, you go through the honeymoon, but you want to have a successful long term, like Megan is mentioning, 10 years, 15 years, 20 years. So we are, when we making recommendation, we are looking into that kind of success. Okay, we want you to be successful, not short term, long term too. Unfortunately, we don't have the vitamin available to purchase in Mexico yet. You still have to do it online. emergebariatrics.com. So I guess when I put the headset, it's a better volume. So probably from here on, I will be using the headset in the webinars. Sure. Okay. I had a gastric bypass. This is probably the last one I'm going to go over. Again, if you didn't hear your response, please circle back, ask us from your coordinators or call our office. I had gastric bypass in 2017. I had a hernia and a sarcoma in my stomach. Can they both be repaired or removed? That's my main concern. So bypass in 2017, she had hernia and a sarcoma. I don't know what sarcoma is, but in my stomach. Seroma? I don't know.
Yeah, there's no problem. That we can repair the yatal hernia. About the sarcoma or seroma, let's be sure what's
Yeah,
what.
just make sure you guys do the health questionnaire. Put all your health history in there, all the medications you're taking, and we would go over it for you. Okay. Well, thank you so much. We're getting to the end of the webinar. I mentioned we are doing a raffle. Oops, just dropped one name. So these are people who are qualified, and I'm just going to pull one randomly. And let's see, LaQuinton Harris. Let me see if I can find you here, and we'll let you talk to us. There you go. I'm gonna let you talk. Actually, she raised her hand already. You need to, there you go. Hi.
Hey, how you doing, Doc? How you doing?
Great. Congratulations.
Thank you so much.
You tell me about yourself. Where do you live?
Um, Well, I'm from Memphis, Tennessee.
Wow.
I live in Nashville, Tennessee now.
Wow, nice.
And I'm a recording engineer, professional recording engineer. I do a lot of vocals and mixing and mastering and recording and things of that nature.
Awesome. And how's your weight loss journey? Tell us about that.
It's fluctuated. It's been up and down, you know?
Mm-hmm.
Fluctuated up and down for sure. And so now I'm ready to go ahead and take a more permanent step forward, especially being I'm training for the fire department. So I think that'll be really good for me.
Yes, yes, yes. We are excited about this for you.
Oh,
And
yeah.
yeah, well, thank you for everyone to attend our webinar. Dr. Montalvo, thank you so much for your time. And we see you down there. I will have the coordinator contact you and
Okay.
we get you all scored away. Thank you again. We see you the next time, or we see you down there in Mexico. Okay. Thank you. Goodbye.
Definitely.
Goodbye.